This video presentation is to guide Bethesda Dilworth employees in emergency response actions. Our objectives will be to review basic codes, department-specific duties, and how to prevent emergencies at work. Once you complete the video, you will need to obtain at least an 80% on the quiz, then fill out the evaluation to complete the course. All of the information provided here may be found in Doc Tract under Policies. Please reference the Emergency Operations Plan, which is updated routinely. Code Red means fire. We review fire response when we do fire drills, and we have a RELIAS module that is geared towards fires and safety. Inadequate or incorrect response to fire could be devastating, as it impacts the lives of residents and staff. You may be familiar with a video that we show in orientation. A man was smoking outside on a patio and accidentally caught on fire from his cigarette. The staff at the nursing home did not respond appropriately and attempted to spray him with a fire extinguisher. The situation was very tragic, and the video illustrates what can happen when staff are not trained in emergency response. It's very important to recognize what each code means. Everyone has a part to play in emergency response. Some of the actions we take can be remembered through acronyms like RACE and PASS. We will also review how to prevent fires and basic evacuation procedures. It's pretty easy to remember that code red means fire because fire is red. In order for fires to occur, there needs to be a source or some type of material that can burn, a spark, and oxygen. On the next slide, we're going to be talking about some of the different things that can cause fires. It's everyone's responsibility to report hazardous situations. Here are some examples. Overloaded outlets, or for example, using the power strips in the resident rooms, cracked or broken outlet covers, papers or clothing on heaters in the resident rooms, people smoking in non-smoking areas, such as resident room or outside where they do not have a receptacle for the cigarette butts, or any electrical equipment that's sparking or smells like something burning. It's very important to get that equipment out of there so that somebody doesn't go down and grab it and try to use it. Every time we bring new electrical equipment into the building, it needs to have a 360 put in so that facilities maintenance can take a look at it and put a sticker on it saying that it is electrically safe to use. And that includes all electrical items. Please pay attention to where the fire pole stations are located throughout the area that you're working in, and also the fire panels. If we detect smoke or heat or fire, the alarms will sound, and you'll be able to see the location on the fire panel. The main panel is located behind the receptionist desk, but there are other additional panels around the building. It should automatically notify the fire department. However, it is always safe to call 911 when the fire alarm is going off to make sure that help is on the way. Typically, the person who is closest to the fire panel is the receptionist, but during after hours, it may be a nursing person who will be responsible for reading the location of the fire overhead. And the way that they do it is to say code red and the location 3 times very loudly so that people can respond. The way that you call overhead is 7700. When you hear the fire alarm going off and they announce the location, it's easy to respond if you know the RACE acronym. R stands for Rescue Anyone in Immediate Danger. Go to the fire and on your way, grab a fire extinguisher and bring residents to the other side of the fire doors so that they will be away from fire and smoke. A stands for alarm. If you see fire and the fire alarm is not going off, pull the fire alarm so that other people can come and help. Notify the front desk and call 911. C. C stands for confine the fire. Make sure that the fire doors, or sometimes called smoke doors, have closed. Close doors and windows that could potentially feed the fire with more airflow. E stands for evaluate. Is the area safe? Could I potentially put out the fire with a fire extinguisher without putting myself in danger? If the fire is small, like the size of a trash can, go ahead and try to put it out. Evacuate. You may have to initiate evacuation, but this will be done with the fire department response as well as leadership. It will be done in an orderly manner without panic, because there are several steps to evacuation that could cause harm to residents if done in a haphazard way. If you're not in the immediate vicinity of the fire, or for any other emergency where you need to get more information on what to do next, you can go to the Incident Command Station. There are 2 Incident Command Stations at Bethesda Dilworth. One is the long-term care receptionist desk, and the other is the rehab receptionist desk. A person there called the incident commander will guide the staff through the emergency steps. This is typically the administrator or the DON or a nursing supervisor, but it will be somebody in the building who's familiar with the staff and residents and the correct response. At each incident command station, there is what's called an incident command box. It's a large plastic bin that contains items that you need during an emergency. It contains reflective vests that are handed out that have specific job duties on them. It also has emergency information and telephone numbers, some paperwork and flashlights, and other items that are needed. Let's go over in more detail how to control and confine the fire. If you do come upon a fire, first, following the RACE acronym, you're going to remove people who are in immediate danger. Then you're going to make sure that the location of the fire is called overhead. If possible, try to contain the fire by shutting doors and windows so that you do not have airflow feeding the fire. Also, get any oxygen tanks out of the path of the fire. And if it's not too big, attempt to put the fire out with fire extinguisher. PASS is the acronym that we use to remember how to use a fire extinguisher. P stands for pull the pin. The pin is a wire pin that has a ring on it that makes it easy to pull. Once you do that, you can squeeze the handle and aim the nozzle at the base of the fire. As you squeeze the handle, it's going to release the contents, and you will sweep the nozzle back and forth to put the fire out. Remember, in a multi-level building, there are measures you can take on the floor that you're on to protect your residents from fire. Make sure that they are on the other side of the fire doors, away from the location of the fire. Always move horizontally before moving laterally. Facilities maintenance or managers should make sure that major electrical equipment is shut off, as well as the gas. As mentioned before, evacuation is determined by the fire department and leadership of the building. Exit routes depend on the location of the fire, but we do practice evacuation routes so that we have a general route that we take to have a safe evacuation. Everybody should work together to save the residents and their coworkers. We will move as many people out as possible by moving the most mobile residents first, those who are walking and those who are in wheelchairs, and then lastly, the bedbound residents. The med sleds are used to take residents down the stairwell. We mark the bottoms of the doors of empty rooms with an X using chalk that's located in the fire extinguisher cabinets. Remember, we have to take some paper medical records so we can adequately care for our residents post-evacuation, and then we will meet in a safe location outside of the building. There may be some department-specific duties that you need to be aware of, but in general, everybody in every department can help with an evacuation or fire response. Make sure that all of the carts that are in the hallway or anything that is cluttering up the hallway is moved out of the way so that emergency crews can get down the hallway easily and quickly. Nursing stat is the code that we call overhead when we need licensed nurses to the scene. Nursing stat is for anything that is a medical emergency. So not just somebody who is unresponsive, not breathing with no pulse, but it could be somebody who fell and hurt themselves, a coworker who is feeling faint from low blood sugar. Anytime that you need licensed nurses to the scene, you would call a nursing stat. It's very important to call nursing stat and not just a generic, I need nurses to such and such room, because when you call nursing stat, the nurses will know that it's an emergency and they will come quickly and bring the crash cart and the AED with them. Be very specific about the area that you're calling the nursing stat to. If you come upon a resident who is unresponsive or is losing consciousness, you can call nursing stat by dialing 7700. It's good for everyone to know where the AEDs are located, but the licensed nurses will be the ones to apply the AED. The licensed staff that are applying the AED and performing CPR should have a current CPR certification. When we use the AED, we are only using it on patients that are unresponsive, not breathing, with no pulse. A code green is called overhead when more assistance is needed in the building. You should be sending a representative from each department to the area where the code was called. Oftentimes in a nursing home setting, a code green is for missing resident. During that situation, somebody should be directing staff to locate the resident in specific areas of the building. They should be providing a description of the resident, when they were last seen, what they were wearing, and how functional they are, if they are walking or in a wheelchair. If possible, they should also be handing out a picture of the resident. Do not spend too much time looking for the resident on unit. If you're not able to locate the resident within 10 minutes, you should be looking outside the building, and if you're looking out in the parking lot and other areas outside the building, please call 911 and notify leadership as well. Remember during a code green for a missing resident that you can initiate incident command. If you have a resident that's verbalizing that they wish to leave the facility, make sure that they are on 30-minute checks and that preventative interventions are in place. Nurses, note the following information may be needed during a search for a resident. There are a lot of different details that you can provide. For residents who are at risk for an elopement, it's important to communicate that out to the different areas of the building. So if that resident were to wander, the other people would be aware. Here's an elopement risk notification form as an example. Something else that you should be aware of is the risk of suicide in the older adult population. If residents are verbalizing that they're very depressed or that they wish to kill themselves, that's something that is an emergency and needs to be reported right away to the nursing supervisor or DON or administrator. Residents may say, "Life isn't worth living anymore. I've lost everything that was ever important to me." Sometimes residents will verbalize these things and they are not suicidal, but we should be reporting these remarks so that the resident can get the help they need. If you ever do find a resident who is passed away, but the circumstances are questionable, if they're a full code, we must initiate CPR. For a do not resuscitate, we will preserve the scene and we will notify leadership immediately. In the event of an unusual incident such as suicide, You would notify the charge nurse, nurse manager, or social services or administrator immediately. If it's after hours, then the nursing leadership will notify. Inform all staff to not discuss what they think happened, and it is definitely not a topic for social media. Code gray is used in the event of a disaster other than fire, and it's typically a weather emergency. If we know we're going to have bad weather, turn on the weather radios and keep track of what's going on outside. Let's talk about the difference between tornado watch versus tornado warning. A tornado watch means that conditions are favorable. You can keep working, but you are to close the windows and blinds and move residents away from the windows. Anybody from any department can participate. During a tornado warning, that means a tornado's been sighted and we are to shelter into the hallway. We do not bring beds into the hallway. If residents are not wishing to get out of bed, we will move their bed away from the window and cover them with a blanket to protect them. We will close all the curtains, including the privacy curtains. A tornado warning will be announced overhead. Nursing should secure a census sheet for their area and medication information. Staff should be in rooms with no windows or in the hallway sheltering with residents. After the danger has passed, an all clear will be announced 3 times. The all clear is also announced during a situation such as a fire, once the danger has passed. In the event of an earthquake, seek shelter immediately, covering your head and neck. Stay away from large objects that may fall over. And at the end of the earthquake, look for any gas leaks, shut off the gas, and check on the residents and your coworkers. First aid and triage areas may need to be set up. As mentioned before, the emergency procedures are located on Vern on Duck Track, which is located all the way to the right as you scroll down to the bottom of Vern. It has all the procedures for major emergencies that we encounter. One of the emergencies that we've not talked about yet are the utility outages. Keep in mind, if we lose power, we do have a generator, but not all of the outlets may be functioning. Therefore, nursing should be checking on the residents, especially those who have oxygen concentrators and low air loss mattresses, to make sure that they are operational. Remember, during extreme weather, such as heat or cold or high winds, staff may need to take a little bit more time to get to work, and staff who are at work may need to stay over to make sure that the residents are cared for. There's also a hazardous communication plan set in place by Bethesda. When you are on Vern, you can look up any chemical that you're working with on the MSDS icon. You can search for the chemical in the search bar. All chemicals should be locked up when not in use, such as bleach wipes. But if someone were to be exposed from a chemical, we can look up on the MSDS sheets what are the safety measures to take. It also tells you how to store the chemical safely. Here's an example of what the MSDS icon looks like. It's also good to know where the eye wash stations are in your neighborhood in case somebody should get splashed with a chemical. This is just an example of an MSDS sheet for Purell. It does say that it is flammable, as is a hazard because it has alcohol in it. It also tells people what to do if they get exposed to Purell, such as getting splashed in the eyes. A bomb threat or act of violence is a possibility in a nursing home setting. If you answer the phone and someone says they have a bomb, quickly alert your coworker to call 911. Take down any information that the caller is saying so that you can let the authorities know when they arrive what they said. If there is a violent intruder, remember run, hide, fight. Run is the best option for survival. Find a way to get out of the building quickly. Do not grab anything, just run. Hide is a second option if you're not able to escape the building. Bar the door, turn off your phone, and hide down low on the sides of the room. Lastly, abuse is an emergency in long-term care. If you witness abuse, stop and disrupt the abuse. Protect the residents. Report anything that could be potentially abuse immediately to your nearest supervisor. In summary, know your fire plan, your nearest exit and evacuation routes. Locate your nearest fire extinguishers and pull stations, and always participate in emergency drills. Take care to keep the hallways and exits clear and report any unsafe situation. And always, if you have a question about your role in a situation, just ask. There are no silly questions. That's how we learn. So we do drills so that people can learn what to do during an actual emergency. So during the drills, everybody be respectful of each other and help each other out. If you know the answer to something, say so. And if somebody is doing something that seems incorrect, speak up so that we can do the best possible job during an emergency to save lives and protect our residents and staff.